Well, Breast Cancer Awareness Month is well underway, and it's a time to learn more about the illness and ways to prevent it. And that's why one local health group is working to provide mammograms for the rest of the year. Kaya Grant from Meridian Health Plan of Illinois is here to tell us more. Kaya, good morning. Thank you for joining us. How are you doing?
Hi, good morning. I'm well.
Okay.
Thank you for having me.
Absolutely. Thank you so much again for being here this morning. So, breast cancer, such a deadly disease that has impacted so many women. In fact, according to you all, the American Cancer Society has stated that 1 in 3 women will be diagnosed with breast cancer. That's a lot of women. First of all, can you talk about any ways that women can prevent this deadly disease?
So unfortunately, breast cancer cannot be prevented. However, it is a devastating disease. Women are being diagnosed at early ages, things of that nature. Actually, what we can do is we can promote early detection, early intervention, and we want to do that through screenings by getting the mammograms.
Okay, absolutely. And speaking of early detection, early prevention, talk about what Meridian is doing in terms of a collaboration with community hospitals. You all have what's called Mammogram Mondays. Mm-hmm. So tell us more about that and how that's helping to, help women in terms of getting their mammograms.
Yes, Mammogram Mondays is something that Meridian has partnered with community hospitals so that we can mobilize, get out there, get into the communities where women can actually schedule their mammograms. They can see providers, and it's actually a place where women can go and they know where they can go throughout the end of the year.
Okay, and I'm not sure if we mentioned this, but it's a mobile unit. So you all are taking some type of a van of sorts and going into different communities.
We're mobilizing to get to people so that we can eliminate not having access to care, because oftentimes that's some of the things that impacts women, where women are not able to actually get to their screenings. They're not able to know exactly how to navigate the system. And so we're coming into the neighborhoods and into the communities so that women are able to achieve their screenings annually.
And can you speak to, obviously getting a mammogram is essential, but women knowing their breast health, because so much I've heard of breast cancer sometimes not being found in a mammogram, but maybe just a regular doctor's appointment or when women do self-breast exams. So can you talk about the importance of that?
It's very important to know your own body and your own health. So knowing your breast health is going to help with that early detection. You want to make sure that you know what to look for so that if anything happens or if anything appears that's outside of normal, you can go ahead and schedule for you an appointment to see your primary care provider, schedule for those mammograms. So any swelling, any dimpling, any discharge, it may not necessarily be the lump. If you have any swollen lymph nodes, pea-shaped lymph nodes, glands around your neck, around your underarms, in that area, those are the things that you're gonna.
All right. Well, Kaya, thank you so much for joining us this morning. Very helpful information. We appreciate you being here. All right, stick with us. Our top stories are coming up next.